This is TTT Live. I'm DK Ronstar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager, Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. Welcome to today's virtual media conference hosted by the Ministry of Health. Here to provide the latest COVID-19 updates and answer questions on COVID-19 and COVID-19 vaccination are Dr. Miriam Richards, Principal Medical Officer, Institutions, Dr. Alana Best, County Medical Officer of Health for St. Andrew, St. David County, and Dr. Abdul Hamid, General Manager Primary Care for the North Central Regional Health Authority. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator for this morning's media conference. We go to Dr. Richards, who will present today's clinical update and give us some general information on COVID-19 vaccination.
Good morning to Ms. Candice Alcantara, our Manager of Corpcom, my esteemed colleagues, Dr. Alana Pomina and Dr. Abdul Halim Hamid. Good morning to all members of the media. It is indeed a pleasure to have you here with us for yet another one of our press conferences as you serve to educate the population in a transparent and up-to-date manner. Also, good morning to the viewing and listening population of Trinidad and Tobago. This morning, I will present a clinical update on the status of the parallel healthcare system, as well as an update on the number of cases and clinical statistics as of 4 p.m. on the 11th of July 2021 per media release 782. It is important to note that all of this information is collected, collated, and analyzed on a daily basis through the Office of the Chief Medical Officer. I'll now start with the clinical update from the media release. And this information is updated, as I said, as of 4 p.m. on Sunday, 11th July 2021. There were 188 confirmed positive cases that were reported in the last 24 hours, and this has resulted in a slight increase in the rolling average, which is the average number of cases per day, from 181 on Saturday to 191 on Sunday. Of course, as far as the hospital occupancies are concerned, the rolling average acts as a predictor for the need for hospital beds within a 3 to 5 day interval. At present, there are 321 total patients in hospitals in the parallel healthcare system, and this covers 9 hospitals, of which 7 are in Trinidad and Tobago, and 2 are in Tobago. There are 108 patients. There were 108 patients as of 4 p.m. in the step-down facilities and 173 patients in state quarantine facilities. We do have an upcoming repatriation of persons from Barbados to Trinidad and Tobago tomorrow evening, and we are making all our efforts to ensure the safe return of our nationals. There are also 5,423 persons in home self-isolation, and these persons are being managed through the relevant county medical officers of health. There are 225,546 persons who received their first dose of vaccines, while of that number, 140,568 have been fully vaccinated with 2 doses. And I'd like to pause and recognize the efforts of all our frontline staff, the volunteers within the private and public sector for your continued support in our national vaccination drive. At present and up until last afternoon, there were 937 deaths. There were 2 additional deaths in the last 24 hours, and we kindly extend our condolences and sympathies to the relatives of these persons. I'd like to now provide an update on the hospitals in the parallel healthcare system, which of course guide our national response and is the Ministry of Health's response to the COVID-19 pandemic. At present, there are 16 facilities that are operationalized for the care of confirmed COVID-positive patients. 9 of those facilities care for severe and critically ill patients, and 7 step-down facilities act as a halfway house between ill patients and their home. They generally care for recovering patients. The overall capacity of the parallel healthcare system is 1,022 beds that are spread across 3 levels of care in the hospitals. As of this morning, 8 a.m., the overall occupancy of the parallel healthcare system is 41%. Now, occupancy is a measure of the capacity of the hospital to manage severe, critically ill, and in step-down facilities recovering patients. This implies that 4 out of every 10 beds in the parallel healthcare system is currently occupied. And we have noticed an overall decreasing trend since on or about May 28th. In Trinidad and Tobago, we have the ward occupancy overall where our least ill patients would be managed at 37%. Yet again, we have noticed a slow but consistent decline in the occupancy. Now we are looking at, again, approximately 4 out of 10 beds being filled. And this trend was noted since May 28, 2021. If we broke up the ward occupancies, in Trinidad, 43%, and in Tobago, 23%. With respect to the actual number of patients in hospital, this morning there are 433 patients who are in the step-down and hospital facilities, and that is across the 16 facilities. At our 9 hospitals, the combined total is 312 persons, and at our step-down, the combined total would be 121. Yet again, we have a consistent and slow decline in the actual numbers of patients in the parallel healthcare facilities. However, it is important to note that we have 3 times as much ill patients as we have recovering patients. And of course, this results in more resources being required within the parallel healthcare system. Another trend that we continue to notice is the high percentage of ICU and or intensive care unit patients and high dependency unit patients. High dependency patients are critically ill, while intensive care unit patients are severely ill, and the resources that are required to manage these 2 categories of patients are much more than our ward level patients. For example, ventilators are needed, special beds, dialysis units, and so on. Now, although we've noticed a decrease in the occupancy overall, the ICU levels continue to be high. And as of this morning, 83% of ICU beds that are in operation are filled. In Trinidad and Tobago, 85% of beds are filled, and in Tobago, all 5 ICU beds at this point in time are filled. Now, beds can be transitioned from a ward level to an HDU level bed, but this statistic demonstrates the clinical severity of this virus. That is, we continue to see very critically and severely ill patients at our hospitals requiring additional resources. High dependency unit, which is the step between ward level patients and intensive care unit patients, continues to fluctuate, and this morning is at 56%. However, the average since May 28 is actually 83%. We also look at measures in the traditional healthcare system, and that is the system that was in place to ensure that non-COVID patients continue to receive the best quality of care. And the parallel healthcare system itself was activated to protect and preserve the traditional healthcare system and so save the lives of COVID patients as well as non-COVID patients. We continue to notice that the traditional healthcare system has been having a decreased number of COVID positive patients awaiting transfers. And as of this morning, across each of our RHAs, we have noticed a value of less than 10 patients per RHA awaiting transfers. Additionally, we have noted that 30% of transfers over the last 24 hours by our ambulance system were due to COVID-19. Lastly, I'd like to reiterate in terms of our 16 facilities that 15 out of the 16 facilities have occupancy levels under that critical 75% level. At present this morning, the only facility with an occupancy level on or about 75% is the Augustus Long Hospital. As I close this morning, I would like to implore and to ask each of you viewing this program or listening on to please continue to practice the 3 Ws. At this present time, we have the same frontline workers, the same doctors, nurses, medical assistants, persons employed within the private and public sector and across several ministries, serving selflessly and unselfishly for the past 17 months. Let us please try to adhere to our vaccine appointments. Let us please ensure that we do get that first vaccine. And if we have a second vaccine appointment, please ensure that your vaccine appointment is kept. You are only considered fully vaccinated 2 weeks after the first vaccine. And even if you are vaccinated, please ensure that you continue to wear your mask, to watch your distance, and to wash your hands. Please, we are asking everyone as we leave to continue to be resilient, to collaborate with us and to support us across the public health regulations and also with respect to the 3 Ws. Once again, as the current approach, as the Honorable Prime Minister said, would be one of personal and social responsibility, please remember that you are only considered fully vaccinated 2 weeks after your second dose or your final vaccine. And even after you're fully vaccinated, you must continue to protect yourself and your family through the 3 Ws. Thank you once again on behalf of my team and every frontline worker, and I now pass you back to Ms. Alcantara.
Thank you very much, Dr. Richards, for that very important reminder of what's fully vaccinated and, of course, to follow the 3 Ws even when you are fully vaccinated. Now we go to Dr. Hamid. We get quite a few questions from diabetic persons asking if they should be vaccinated. Let's go see what Dr. Hamid has to say on this topic.
Hi, good morning. Good morning to Dr. Richards, Principal Medical Officer, Dr. Alana Best, CMOH, St. Andrews, St. David, and thanks very much, Ms. Candice Alcantara. So today starts a very brief series of COVID-19 vaccine guidance. And basically what we want to do is to encourage persons to not to stay on the fence or persons who still undecided to just come out and get that vaccine, that COVID-19 vaccine. First slide. So COVID-19 and diabetes mellitus, the care of patients with endocrine disorders, including diabetes during the coronavirus disease, poses unique challenges. And from the outset, the WHO had indicated that diabetics, hypertensive, and anybody with NCDs are very, very high risk for getting complications due to COVID-19. And especially diabetics, they are very much more at risk for severe illness. So COVID-19 appears to precipitate some very severe manifestations of diabetes, such as diabetic ketoacidosis, hyperosmolar disorders. Next slide, please. So patients with type 2 diabetes are more likely to have serious complications, more ICU admissions, longer length of stay, and deaths from COVID-19. In some studies over the course of the year, 7.3% fatality rate was noted in China, whereas the overall case fatality rate was 2.3%. In USA, however, the mortality rate was 14.8%, whereas 6.2% without either diabetes or uncontrolled hyperglycemia. Next slide. the role of high blood sugar. So poorly controlled diabetes is a very, very high risk factor for any infection in general, not just COVID-19. Elevated BMI also was associated with increased COVID-19 mortality. Next. So the take-home message, basically what we want to do today, and starting a series as we go along, so diabetes may increase the risk of severe COVID-19 disease and death. The one primary prevention that we can do is in the form of vaccination, and it's across the globe the mainstay for mitigating the risk associated with COVID-19 in patients with diabetes. And in Trinidad and Tobago, diabetics have been prioritized for receiving COVID-19 vaccines. Vaccines available locally have been shown to be safe and effective and protect people against COVID-19. And we do encourage everyone with diabetes to get vaccinated as soon as they're able to. So we want to reach a point. Now I have to congratulate persons. We have an extremely high vaccine acceptance for our nation. And we want to be able to say all diabetics at some point fully vaccinated in this country, Trinidad and Tobago. Thank you so much, everyone.
Thank you very much, Dr. Hamid, for that information for those who are diabetic in Trinidad and Tobago. Earlier on from Dr. Richards, we got the national perspective on COVID-19. And now we go to Dr. Best to get an update on what's happening in County St. Andrew, St. David.
Good morning, Dr. Abdul Richards, Dr. Hamid, Ms. Alcantara, members of the media, and members of the viewing and listening public. Thank you for inviting me to talk with you today. As we are all aware, nationally our numbers are improving. While we are pleased with the improvement, there are still a few areas of concern. So I'll share with you some scenarios that we have observed in our county. The workplace remains a place of increased risk because persons are still not wearing their masks while at work. Let me share a recent scenario. A symptomatic person turned up for work. It turns out that this person was in fact COVID positive and infected a co-worker. Let's call this co-worker Mary. Mary has a teenage child who is writing CSEC examinations. Because Mary is now positive, and after interacting with her positive work colleague, Mary's child is now considered to be a primary contact. And this child now has to be placed on quarantine and will miss the CSEC examinations. This teenager's educational progress has been delayed because someone opted to turn up for work while symptomatic and infected the child's mother. The choices you make can have a lasting negative impact beyond what you can ever see. Your personal choices are in fact not so personal. Please remember, if you are not well, do not go to work. If you have symptoms of headache, fever, cough, body pain, if you've lost your sense of smell or taste, if you're experiencing diarrhea or vomiting, please get tested. While you are at work, please wear your mask. The mask should cover your nose, mouth, and chin. When you are eating lunch, you will obviously not be wearing your mask. But please continue to protect yourselves by avoiding sitting close to others while eating, and if possible, eat alone. We continue to encourage persons that once the opportunity is available, that you should get vaccinated and take the vaccine that is currently available to you. We want to fully vaccinate persons as quickly as our resources allow so that we can reduce the risk of persons contracting COVID-19. And even if they do test positive, fully vaccinated persons are less likely to have serious complications or die. And certainly on the national scene, we have had no deaths in persons who have been fully vaccinated. Please permit me to highlight the case of one of our homes for the elderly, in which we had 52% of residents and staff test positive for COVID-19. Thankfully, though, at this home for the elderly, 54% of the staff and 70% of the residents were vaccinated. We did not have any deaths arising from cases at this home, and in fact, most persons were asymptomatic. I want to point out, in this group, we had somebody who was over the age of 100, fully vaccinated, and he remained negative. This case illustrates the importance of having our vulnerable population vaccinated. And so I'd like to make a plea to relatives to encourage their elderly ones to be vaccinated. We want to avoid unnecessary hospitalization and death. A week from today, we will have easing of the public health restrictions. As more businesses will be open, please be mindful of keeping at least 1 to 2 arms lengths away from those around you. And at the end of this week, larger numbers of friends and relatives whom we have not seen for a long time will be returning home. You are going to be excited to see each other. When you see someone for the first time, your reflex will be to hug and kiss them. But please, don't do it. If they do not belong to your household, avoid the physical interaction. You might want to make a line with someone who has returned home. However, the public health measures are only effective if they are consistently observed. This is not a time to throw caution to the wind. We will be thrilled to have our family and friends back home, even if they're here for a short visit. But it is in your best interest to assume that everyone you see is a potential source of infection. Don't drop your guard. Yes, vaccines do reduce the likelihood of a vaccinated person transmitting the virus to others. It is still, however, crucial that we maintain the public health measures of wearing our masks, washing our hands, and watching our distance. Being fully vaccinated does not mean that we drop the ball with these public health measures. My team and I cover the county of St. Andrew, St. David, which covers Sandy Grande and the environs, and our operations are embedded within the Eastern Regional Health Authority. Back in early June, we had a peak of about 466 positive cases. Today, we have 165 cases, and our sister county, River Mayaro, has 85 active cases. So we are quite pleased with the improvements that we have been seeing. Caring is the key at the Eastern Regional Health Authority, and we are particularly excited to learn about the 800,000 doses that are expected to arrive this week. Within the ERHA, we currently offer vaccines at the Mayaro, Rio Claro, Toco, and Kumana Health Centers, the Sandy Grande Enhanced Health Center, and the Sandy Grande Civic Center, as well as the Mayaro Sporting Facility. When we receive our allocation out of the 800,000 doses, we are expecting to roll out vaccinations to all 18 of our health centers across the Eastern Regional Health Authority. In anticipation of this wider rollout of the vaccination drive, we have already begun to make contact with community groups within our catchment area. For example, religious groups, agricultural societies, fisherfolk groups, and chronic disease support groups. We are liaising with them to get lists of interested persons who want to be vaccinated. These community groups will be facilitated by appointment at the following sites: the Mayaro Sporting Facility, the Sandy Grande Civic Center, and the Cumaca Roman Catholic Church in Valencia. This means that within the ERHA, we will have 2 parallel streams. We will continue to offer vaccinations at our health centers for persons attending our various clinics. And we will also have an outreach program targeting our community groups. Our aim is to follow the science and improve our vaccination rates so as to reduce the complications and potential deaths associated with COVID-19 infections. And again, I re-emphasize, we have had no deaths in any fully vaccinated person to date. As I draw to a close, let me take this opportunity to thank our healthcare teams, our nurses, doctors, attendants, pharmacists, patient care assistants, EMTs, clerks, phlebotomists, radiographers, public health inspectors, who continue to provide service on the front line. And a special thank you to the administrative staff who work tirelessly behind the scenes to keep the system afloat. And of course, to end, I must say, wear your mask, wash your hands, and watch your distance. Thank you.
Thank you very much, Dr. Best, for those reality checks, some real-life examples of the effectiveness of public health guidelines and what can happen if we follow them and what can happen if we don't. You will see a connecting thread between all of the presentations, and that is to get vaccinated once the COVID-19 vaccine is made available to you. But there still are members of the public with concerns, and these concerns make them hesitant to get vaccinated. So let's address some of these public questions so that we can take you to vaccine acceptance. First question: is it true that the COVID-19 vaccine makes you magnetic? It's a question that we've seen coming to us from the public. And so we go to Dr. Best for a response.
Thank you, Ms. Alcantara. I wish to assure members of the public that none of the WHO-approved vaccines has or will make anyone magnetic. Thank you.
Thank you very much, Dr. Best. To the point from a medical expert. The next question that we see coming to us in various forms are COVID-19 variants caused by the COVID-19 vaccine. I'll repeat, are COVID-19 variants caused by the COVID-19 vaccine? And we'll go to Dr. Richards for a response.
So thanks, Candice. The short answer is that the COVID-19 vaccine does not cause variants. Variants are spread amongst unvaccinated persons, and the COVID-19 virus is safe and effective in protecting you, your loved ones, your co-workers, and the vulnerable persons who are unable to be vaccinated at this point in time from the COVID-19 virus. We would like to encourage all of our population to please ensure that you are vaccinated if you fit the relevant criteria. Thank you.
Thank you very much. And Dr. Richards, I think the third question will go to you as well. Persons are asking, if vaccines are necessary, since persons can build natural immunity, and I suppose this relates to persons who have recovered from COVID-19 vaccines. So are vaccines really necessary?
Yes, vaccines are necessary, and all across the world, and I would say the vaccines have been able to protect populations, especially against diseases such as smallpox and polio, which are only really present in very small pockets globally. The vaccine itself is safe and effective, and we have noted through WHO research and guidelines that countries that have a high vaccine uptake have noticed a decrease in the number of deaths and hospitalizations due to COVID-19. Over 170 million doses of the COVID-19 have been administered globally, and the COVID-19 vaccine not only protects you from obtaining COVID-19, but it also protects the persons around you who may not be able to take the vaccine at this point in time. For example, younger children, pregnant women, or persons with severe autoimmune disease. The COVID-19 vaccine reduces the risk of death in high risk and persons with complications, and it also reduces the risk of hospitalization, and so it should reduce the number of persons who are admitted into hospitals in our parallel health facility, as well as the high dependency units and the intensive care units in our country. In closing, we would like to encourage everyone to please be vaccinated and to continue to practice the 3 Ws. Thank you.
Thank you very much, Dr. Richards. And we go now into the question and answer segment where we field questions from members of the media. Media representatives, please begin by stating your name and the media house that you represent before posing your 2 questions maximum. Please ask both questions at the same time, and we'll move through as quickly as possible. If we have additional time, of course, we will come back to those who have more questions. We begin with questions from Guardian Media Limited, CNC3.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. Okay, so I just want to follow up for my first question on something Dr. Best would have mentioned in her presentation. Is the ministry aware of, or do you all have any figures for how many students might have missed any of these recent examinations because of quarantine or isolation, like that situation you outlined, Dr. Best? And now for Dr. Richards, now we're opening back up some sectors of the economy, right? Next week, we are seeing food places reopening to an extent. When this mass vaccination drive begins on Friday, are any doses being allocated specifically for persons within these sectors? I'm thinking about like the doubles man and these street food vendors. Will they be given any preference to get a COVID-19 vaccine in light of that? Thank you.
Thank you, and we go to Dr. Best for response to the first question.
Thank you for the question. The health team at the Ministry of Education liaises with each county to get from us the number of students that may have been affected, who may either be in quarantine because they were primary contacts or who themselves have been diagnosed with COVID-19. And so that data should be available to you from the Ministry of Education.
So I'll go on to the second question, Rashad, regarding the mass vaccination of persons in the food and beverage industry. Once the 800,000 doses of Sinopharm are received, allocations will be made to the different sectors. Of course, the information on this will be available in the public domain, hopefully within the next week. Thank you.
Thank you very much, Dr. Richards. We go now to AZP News, please.
Hi, good morning. Kwai Bihari, ACPnews.com. I just have one question, maybe for Dr. Alana Best. Can you give us an idea in terms of rural versus urban? Have you found a difference maybe in COVID-19 deaths and new cases in one area as opposed to the next? That is urban areas versus rural areas. Thank you.
Dr. Best?
Thank you for that question. So where there are people, we will find that the virus circulates. So certainly the Eastern RHA covers a very wide area on the eastern seaboard of Trinidad. And certainly in our more densely populated areas like Valencia and Sandy Grande, we will see a higher number of cases there as compared to areas like Matlot or Mearu, where the population density is less. So yes, there is a distinction between urban and rural. In more urban areas where there are more persons, the virus obviously circulates more commonly in that environment.
Thank you very much, Dr. Best. We go now to 103.1 FM, please.
Hi, good morning, everyone. Rai Rikomas from 103.1 FM. My first question is to Dr. Abdul Richards regarding tomorrow evening's repatriation flight of students from Barbados. Now, the Delta variant has been identified there, according to the CMO across there. What measures are in place to ensure that there is no spread or introduction of this Delta variant into Trinidad and Tobago through repatriation flights such as these? My second question is to Dr. Alana Best. You mentioned workplace being an area where the virus can spread and has spread in some instances. But do you have any details or figures or statistics that you can share with the national public as to how prevalent workplace spread of COVID-19 is?
Thank you very much. We go to Dr. Richards and then Dr. Best.
Thank you very much for that very topical question regarding the Delta variant. Now, the border control process is a joint effort between the Ministry of National Security, which is responsible for the approval of the exemptions, and the Ministry of Health, which is responsible for the quarantine arrangements once persons enter Trinidad and Tobago. Various steps are taken to mitigate the risk of the virus, and once we mitigate the risk of the virus, we are looking at mitigating the subsequent variants. As of now, there are no confirmed cases of the Delta variant in Trinidad and Tobago. Now, the first risk mitigation or risk reduction measure would be to ensure that all persons returning to Trinidad and Tobago have a negative PCR test, which is the gold standard for testing, that it has a high level of accuracy prior to their embarkation on the airline. And this risk mitigation or risk reduction measure has really worked quite well internationally as well as locally. Of course, if the airline agent on site notices that a person is unwell, they are restricted from boarding the airplane. So these are the measures that occur before boarding the airplane. On the airplane itself, the occupancy has been decreased from the pre-COVID sorts of occupancy to ensure social distancing. And on these airlines, persons must wear masks as well. So there is the practice of the 3 Ws on the airline, an additional risk mitigation measure. Upon landing and arrival in Trinidad and Tobago, the 3 Ws continue to be practiced at the airport and in the transfer of persons to the respective quarantine sites. And at present, there are 12 quarantine sites that are available for returning nationals. 7 of those sites are state-supervised facilities, which are private hotels, and 5 of those sites are state quarantine facilities with costs borne by the government. At these quarantine sites, persons are basically contained because their risk level is not known, and they receive a day 6 test. If they are negative, they are allowed to go home for 7 days further of home quarantine with the relevant follow-up and surveillance by the County Medical Officer of Health. If they are noted to be positive, they are immediately transferred to an institution within the parallel healthcare system to reduce the risk of them developing complications, to isolate them from persons because they may have a variant form of the disease. And of course, variant testing is done on all returning nationals. Lastly, persons are allowed home after the Ministry of Health policy regarding the hospitalization stay or the step-down stay once they receive a negative test, and they are continued to be followed up. So I hope I've answered your question about the different measures that are taken from the approval of the exemption process to even persons who are deemed COVID positive and their clinical management. Of course, this will reduce the spread of COVID-19 within our population. And once again, thank you to all returning nationals for your patience, and sincere gratitude and thanks to the exemption team and all persons that are involved in the logistics of this exercise.
Thank you, Dr. Richards. Now to Dr. Best to respond to the second question.
Certainly our experience in the county has been that it's the household contacts that are the highest risk for contracting COVID-19 once there's a positive member in the household. Because as within most homes, we generally don't wear masks, and obviously we are sharing common surfaces. This is why we try and emphasize that there should be no mixing of households during this time so as to reduce the impact if there is in fact a positive person within a household. Our observation with regards to workplaces has been that workplaces that are strictly adhering to wearing the masks and frequent hand washing and have put up measures to reduce interaction between co-workers, that those workplaces we haven't had many positive colleagues arising. But obviously, if you're working in an environment where you get to work, you take off your mask, you continue to interact with your colleague as though there is no pandemic going on, that kind of work environment is a higher risk, and that is where we are seeing the virus circulating quite freely within our county. So again, please avoid mixing of households. Continue with the 3 Ws, whether you are in an environment with people you know or people that you are not familiar with. It is still important to behave as though everyone around you is a potential source of infection so as to protect yourself.
Thank you very much, Dr. Best. Just a reminder to members of the media that we also have Dr. Abdul Hamid here with us, and it would be a great opportunity to pose questions to him as well. We go to I-95.5 FM, please.
Yes, good morning to everyone. Whitfield Turner from I-95.5. Dr. Richards, I think I can ask you my first question, which is linked to Rai's question from earlier, just to confirm, will the repatriation and exemption process come to an end once the borders reopen? And my second question for either of you, persons are asking, can stroke patients also take the vaccine?
Thank you very much. So we'll go to Dr. Richards for the first, and I think Dr. Hamid will address the second question. Thank you.
Thank you very much. As indicated by the Honorable Prime Minister, the borders will be opened soon on July 17th, and we have confirmed that a new policy for border control, which will be managed primarily by the Ministry of National Security, will be in place. Details of this policy have been shared and are available on the public domain. Thank you.
And to Dr. Hamid.
Hi, thanks very much for the question. And yes, stroke patients can receive the vaccine. And what we have noticed, especially when we have been approaching the long-term residential care homes, many of their patients are stroke patients, and we have been giving the vaccine to them in those areas, as well as the shut-in patients as well. So it is encouraged, as it provides a guaranteed level of protection from either hospitalization or complications due to COVID-19 if they get infected. Thank you.
Thank you very much. We go now to Express newspaper, please. Are we ready with Express newspaper?
Morning, Kim Woodrum, Express.
Right. Thank you, Kim. Two brief questions.
Okay.
Thank you.
Thanks. Morning. Dr. Abdul Richards, you did touch on this earlier, which is the necessity of getting vaccinated. So this is not to dispute that, but to go back there and ask, some countries have started to recognize prior infections as a form of unacceptable form of immunity, and therefore, for instance, would allow their returning nationals, if they've been infected abroad, have recovered, and perhaps even have had one dose, let's say, of their vaccine, to come into the country and not necessarily have to quarantine once they present with a negative PCR test. So given that full vaccination does not actually, no one is sure if it protects you against being reinfected, well, why is TNT not recognizing, for instance, people who have been stuck abroad for a while and may have been infected while there and have recovered as a form of immunity? I hope that question was clear. And also, are you in agreement with the opening of the borders or the planned opening on the 17th of this month, given that the variant is not just in the region, but right next door as well? All protocols in place, of course, being understood. Thank you.
Thank you, Kim. So the first part of the question referred to entry requirements for persons who have COVID-19 or previous infections. Now, it is sovereign right of any country to confirm and to recommend mandate border entry requirements. At present in Trinidad and Tobago, we are guided by the World Health Organization recommendations that recommend that persons are vaccinated and fully vaccinated 2 weeks after their second vaccine. Now, subsequent to the opening of the borders on the 17th of July, persons must receive 2 vaccines and have a 2-week interval between the second dose of the vaccines to be considered vaccinated. The second part of your question concerned or was my opinion. You're asking my opinion regarding the opening of the borders given the presence of the variant within this region and United States, where most of our persons would be traveling from. The Honorable Prime Minister guides this policy, and of course he has shared with the population, and it is clear in the public domain, that the borders will be reopened on July 17th. Thank you very much.
Thank you very much, Dr. Richards. We go now to Tobago Channel 5, please.
Hi, good morning. Candice Jackson from Tobago Channel 5 News. My question to Dr. Richards is, you mentioned earlier that there is an increase in high dependency patients as well as ICU patients. What is the state of our ventilators and that sort of thing in this country? And are we trying to get more and also to have an additional set of beds in Tobago, because as you said that our ICU beds in Tobago are full at this point in time, and we are actually also experiencing an increase on the island, and there are a lot of really sick patients. But what is being done to increase that capacity for ICU care, and of course the equipment challenges, or if we have any equipment challenges? Thank you.
An excellent question. Now, the high rate of occupancy within the ICU and HDU wards really suggestive of the clinical severity of this disease. So persons with COVID-19 can develop severe complications in the ICU, requiring ICU and high dependency unit care, which of course is that interim or intermediate level of care. Your question focused on the ability of the Ministry of Health to upscale or to increase the capacity for ICU care. I'd like to reiterate that we can convert and transition beds, for example, a ward level bed to a high dependency unit bed to an ICU bed. The differences in transitioning these beds would be based on the clinical coverage. So the nursing ratio would really be increased towards patients. So you would have, less nurses to a single patient. Additionally, the ability or the presence of equipment such as ventilators, cardiac monitors, and syringe monitors really would guide the sort of ward level of the bed. At present in Trinidad and Tobago, we do have approximately 30 ventilators that are in storage and can be commissioned if required. So there is the presence of the consumables as well as the supporting equipment like syringe pumps and oxygen lines, as well as ventilators. So we are confident that we can upscale these beds as required. And throughout this increased number of cases in the parallel healthcare system, we have been doing that by activating additional hospitals and increasing the number of beds. Your next part of the question focused on the situation in Tobago. And for accuracy, I would suggest that such questions are directed to the Tobago House of Assembly and the TRHA. Thank you.
Thank you very much, Dr. Richards. We go now to Newsday newspaper, please.
Good morning, everyone. Thank you for Newsday here.
Good morning. I don't know if we're hearing you loud enough. Maybe just speak a little louder so we can hear you. Sorry.
Sure, no problem. As the ministry prepares to ramp up mass vaccinations, is the online system up and running? If not, when will it be? My next question, you spoke about the diabetes earlier. Can you provide statistics on how many non-diabetic patients have been vaccinated, or maybe an average percentage of those registered in clinics? Thank you.
Thank you very much. Dr. Richards, I think, will tackle the first question, and then we'll go to Dr. Hamid for a response to the second.
The public will be made aware through the Ministry of Health and various media houses of the rollout plan for mass vaccination. And that rollout plan, of course, would involve an online system, but details of this will be provided or should be provided through the public domain by the media and other sources.
Thank you very much. Now to Dr. Hamid, please.
Hi, thank you so much for the question again. And in terms of the chronic disease, diabetics in particular, we have all the RHAs have been using their chronic disease registries in terms of getting those persons from the registries to be vaccinated. At this point in time, it's still an active process, so an average figure cannot be given at this time. But I can say for sure that the uptake and the acceptance amongst diabetics have been really heartening in terms of the clinics and so on that they have been attending to. Thank you.
Thank you very much. We go now to CL Communications, please.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications. I was just wondering, we've heard of a vaccine strategy plan for the manufacturing sector, for the supermarkets, and for other groups. I was just wondering if we had a vaccination plan for the retailers and the employees who work within the retail sector. So that's my first question. My second question is about a press conference ago, maybe two, the issue of testing for variants and more so the variants that are surfacing. I think what was said was that there's going to be more testing being done. I was just wondering, when it comes to the Trinidad Public Health Labs, what does this mean in the context of, is there going to be a physical expansion of the public health labs? And is there going to be a need for more professionals within that area? Thank you.
Thank you very much, Ms. Singh. We go to Dr. Richards for a response, please.
At present, the Ministry of Health is working closely with several stakeholders, such as chambers and persons in the private sector, to ensure that a vaccine rollout plan is carried out for persons within that sector. So we will provide further information once additional vaccines are available for the rollout of vaccines within the retail sector and employees and where they would be applicable. The second question concerned the upscale in laboratory facilities such as the Trinidad Public Health Lab. And when we consider increasing the capacity across lab testing, please note that it is done systematically. For example, we don't just increase at the TPH health plan or the public health lab, but across all the regional health authorities. Thank you very much.
Thank you very much. And I think we just got some information that we are tackling the retail sectors through the various chambers in some of the key areas of Trinidad and Tobago. So working very closely in partnership with private sector Trinidad and Tobago. We go now to TV6, please.
Hello.
Hi. Good morning.
First question is for Dr. Abdul Richards. You would have mentioned that you've seen an increase, a recent increase in the rolling day average. I wanted to find out if the ministry has identified any particular event that may have led to this increase, and if it could have probably been linked, or is it possibly linked to mass movements of persons going to get vaccinated at all? And also the second question is, could the ministry state generally which groups of persons are not recommended to get vaccinated based on their health condition? Thank you. An autoimmune person was asking.
Thank you very much. Dr. Richards will take the first. I think Dr. Hamid can help address the second.
So the first question featured around the little variation in rolling average. And this is not a significant variation. The variation over the last week has been anywhere between 170 and 181 cases. At this point in time, we cannot confirm if this insignificant increase really has been due to any particular event or gathering. But we obviously do trend analysis. It is very unlikely, however, because of that very small and that tight range in terms of the rolling average. I'll now pass over to Dr. Hamid, who will describe the groups of persons who may not or are not recommended to be vaccinated.
Hi, good morning again. So basically, there are no specific groups of persons who are not actually recommended to be vaccinated at this point in time, according to the WHO. However, as addressed the autoimmune disorders, those should be cleared first by their private physicians or their physicians in the hospitals or so on for eligibility for vaccination. So at this point in time, there are no actual specific groups in terms of not being recommended for vaccination. Besides pregnant women, at this point in time, as we have the national guidelines state.
Thank you very much, Dr. Hamid. And I think we have come to the end of questions, unless we have some follow-up questions. I see 103.1 FM. We have limited time, so let's get straight into this follow-up question, please.
Yes, thank you for the opportunity for one more question. I just has to go back to variant testing, especially as it relates to the Delta variant and the reopening of borders. For quite some time, we've heard that we are going to ramp up testing of for the variants, the genetic sequencing. Has that happened? And if not, when is it going to happen, especially with the opening of borders just around the corner?
Thank you. Dr. Richards?
The University of the West Indies, in collaboration with the Ministry of Health across our labs, has ensured that sufficient resources are available for variant testing, and as resources are required to be allocated, this will be done. Thank you.
Thank you very much. And a last brief question from Guardian Media Limited, please. Mr. Khan, one follow-up question from you.
All right, thank you very much, Candice. Okay, so Dr. Richards, Minister Young, about 2 weeks ago when they toured the Piarco International Airport, would have stated that we're doing away with state quarantine. So I just want to know, do we have a trajectory on when exactly we'll be phasing out these facilities?
So thank you, Rashad. A lot of questions around the opening of borders, understandably. The border control measures are really being managed through the Office of the Prime Minister and the Ministry of National Security, and information on the provision of state quarantine facilities will be shared in the public domain. Thank you.
Thank you very much, everyone. Thank you for joining us for today's media conference. We have come to the end this morning, and we hope that we've provided some important information to all of you. Remember to protect yourself and others against COVID-19. Please stay home if you are ill. Please remember to wash or sanitize your hands and stay away from others that are not in your household bubble. That includes auntie and uncle. It includes your co-workers. Make sure that you take the COVID-19 vaccine once it is offered to you. This is very important. We're coming up to a large delivery of vaccines, and we really want people to come forward and get vaccinated. And of course, to everyone, make sure that you wear your mask over your nose and your mouth and covering your chin. Do have a good day, everyone, and thank you for joining us.